Hello and welcome back to HBB Strictly Education. So today we're going to be talking about what is arthritis, where does it come from, and how can you manage it? What is arthritis? Arthritis is inflammation of the joints causing pain, stiffness, and reduced mobility. Now, there are common locations where arthritis occur, which is the hands, the fingers, knees, hips, spine, the neck and the lower back, feet, the ankles, shoulders, and elbows. Anywhere that there's joints, you can develop arthritis. There are 100 types of arthritis, but the most common are osteoarthritis, which is the breakdown of cartilage in the joints, and then we have rheumatoid arthritis. So we're going to talk about these two arthritis, but understand that there are 100 types of arthritis. Where does arthritis come from? Osteoarthritis causes are wear and tear over time, joint injuries, and obesity, which puts extra stress on the joints. Now, some forms of arthritis, like rheumatoid arthritis, can also affect other body systems, including the skin, the eyes, lung, and blood vessels. The location and extent of arthritis can vary from person to person. So each person can have arthritis in a different place. Rheumatoid arthritis. Some of the causes of rheumatoid arthritis. First, there's risk factors, the age, genetics, gender, and smoking. Environmental toxins cause exposure contributing to inflammation. Imbalance in the gut bacteria leading to leaky gut. Nutritional deficiencies, a lack of vital nutrients like vitamin D and omega 3s. Food sensitivity. Certain foods potentially trigger inflammatory responses. So these are some of the causes that can really cause these arthritic issues. So recommendations for rheumatoid arthritis is limit fried food, choose healthier cooking methods, focus on anti-inflammatory foods, incorporate antioxidant-rich foods in your diet. So there are things we could do that could help eliminate some of the arthritic pain. Sedentary behavior. Lack of movement reduces joint flexibility over time. This can lead to decreased range of motion and increased pain. Increased inflammation and prolonged sitting is associated with higher levels of inflammatory markers in the body. This can exacerbate arthritis symptoms. So, poor blood flow can slow healing and nutrient delivery to the joints and tissues, which I never knew that if we didn't like really move around a lot that we could wind up with arthritis. Like we really, if you're working at a job and you're sitting down most of the day, like receptionist or someone that's at a front desk or something like that, you really need to get up and move around as much as possible because this can cause slow healing and nutrient delivery to the joint tissues. So we want to be able to move around as much as possible. Sedentary lifestyle often leads to weight gain. Extra weight puts more pressure on weight-bearing joints like knees and hips, decreases flexibility. So the lack of movement leads to increased joint stiffness, but there's a fluid which lubricates the joints. But if we're not moving around, it cannot circulate as effectively as it would if we were moving around. So inactivity causes muscles to weaken. And once these muscles begin to weak, there is less support for joints, increasing stress and pain in our bodies. So we must move around. We got to get up and move around as much as possible. How to manage arthritis. Anti-inflammatory diet, gut health support, stress management techniques, detoxification protocols and supplements, and also mind body techniques like yoga. So there are things that we can do to help alleviate the arthritis in the body. There's supplements, there's ways to cook, things that can help us with arthritis. Supplements for arthritis: glucosamine and chondroitin, omega-3s, fatty acids, turmeric and curcumin, vitamin D, and SAMe. Always consult a healthcare professional before starting any supplement regimen. So with glucosamine and chondroitin, if you are gluten intolerant, I don't think you could take that. I think that has gluten in it. But turmeric and curcumin, if you take turmeric every day and sprinkle it over your food, not heavy, you won't taste it, just to sprinkle over your food, in about 30 days, you will see a difference. You can sprinkle it over breakfast and sprinkle it over your dinner, and you will see a big difference in your knees or your joints after 30 days because it truly, truly, truly does help. Um, Also, your vitamin D, and if you just have joint pain that pops out of nowhere, get some B12. Well, that is it for this video. I hope that I was able to help someone. Please visit our YouTube channel at youtube.com/@HBB Strictly Education. And I'll see you guys in the next video.